Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Routine cerebral embolic protection during transcatheter aortic valve implantation. Background. Transcatheter aortic valve implantation, TAVI, is associated with procedure-related stroke. Cerebral embolic protection, CEP, devices may reduce embolization to the cerebral circulation and hence the incidence of stroke. Conclusions. Among participants undergoing TAVI, routine use of CEP did not decrease the incidence of stroke within 72 hours. Next article. Efruxifermin in compensated liver cirrhosis caused by MASH. Background. In Phase 2 trials involving patients with Stage 2 or 3 fibrosis caused by metabolic dysfunction-associated steatohepatitis, MASH, Efruxifermin, a bivalent fibroblast growth factor 21, FGF21, analog, reduced fibrosis and resolved MASH. Data are needed on the efficacy and safety of Efruxifermin in patients with compensated cirrhosis, Stage 4 fibrosis, caused by MASH. Conclusions. In patients with compensated cirrhosis caused by MASH, Efruxifermin did not significantly reduce fibrosis at 36 weeks. Next, we will be discussing articles from Journal of American Medical Association. Complete AI-enabled echocardiography interpretation with multitask deep learning. Question: can artificial intelligence, AI, fully automate echocardiogram interpretation? Findings. This study reports the development and validation of an automated AI system for echocardiogram analysis, pan-echo, that performed 18 diagnostic classification tasks, with a median area under the receiver operating characteristic curve of 0.91 and 21, echocardiographic parameter estimation tasks, with a median normalized mean absolute error of 0.13. Meaning an AI system can automate complete echocardiogram interpretation with high accuracy, potentially accelerating workflows and enabling rapid cardiovascular health screening in point-of-care settings, with limited access to trained experts. Next, we will be discussing articles from Annals of Internal Medicine. Risk for stroke after newly diagnosed atrial fibrillation during hospitalization for other primary diagnoses. Background. Atrial fibrillation, AF, that is first diagnosed during hospitalization for other causes, can subside with resolution of the inciting stressor. Objective. To describe the risk for stroke after newly diagnosed AF during hospitalization for other causes. Conclusion. Among patients with newly diagnosed AF during hospitalization for other causes, a substantial proportion with low CHA2 DS2-VA scores receive anticoagulation, with modest increases in this proportion at higher scores. The stroke risk in patients with CHA2 DS2-VA scores greater than 4 approximated the 2% threshold commonly used to initiate anticoagulation in AF. Next, we will be discussing articles from British Medical Journal. Effect of UK Quality and Outcomes Framework Pay for Performance Programme on Quality of Primary Care. Objective: to systematically review the 1- and 3-year impact on quality of care of the introduction and withdrawal of financial incentives in the UK Quality and Outcomes Framework Pay for Performance Programme. Conclusion: Quality and Outcomes Framework incentives consistently improved quality of care at 1 year beyond that predicted by pre-incentivization trends, but by 3 years the impact was inconsistent and not clearly better than trend. Gains from incentivization seemed to reverse after incentive withdrawal. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology. Histological severity, clinical outcomes and impact of antiviral treatment in indeterminate phase of chronic hepatitis B, a systematic review and meta-analysis. The incidence rates of HCC, cirrhosis, and hepatic decompensation are significant in patients in the indeterminate phase. A significant proportion of patients in the indeterminate phase have significant liver fibrosis and inflammation. Antiviral therapy may reduce the risk of HCC in high-risk subgroups within the indeterminate phase. Future studies should determine antiviral treatment indications in the indeterminate phase using a more consistent definition. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Clinical Gastroenterology. The tissue systems pathology test objectively risk stratifies patients with Barrett's esophagus. Results from a multi-center U.S. clinical experience study. Background. Barrett's esophagus, B, is a diagnosis of esophageal intestinal metaplasia, which can progress to esophageal adenocarcinoma, EAC, and guidelines recommend endoscopic surveillance for early detection and treatment of EAC. However, current practices have limited effectiveness in risk stratifying patients with B conclusions. The TSP9 test identified a high-risk subset of patients with NDBE, who were predicted to progress at a higher rate than confirmed LGD, enabling early detection of patients requiring management escalation to reduce the incidence of EAC. TSP9 scored the majority of patients with NDBE as low risk, providing support to adhere to 3 to 5 year surveillance per guidelines. Next article. Delayed perforation. After endoscopic resection of upper gastrointestinal tumors, CT findings to identify patients requiring surgery. Purpose. To determine the clinical and imaging factors associated with surgical treatment in patients with delayed perforation after endoscopic resection of upper gastrointestinal tumors. Conclusions. CT findings of gross perforation and peritonitis are significant factors associated with surgery in delayed perforation after endoscopic tumor resection. These factors can aid in guiding the patients towards an appropriate treatment plan. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Antimicrobial Stewardship and Beyond. The many essential roles of infectious diseases pharmacists. Infectious diseases, ID, pharmacists, are experts in antimicrobial pharmacology and pharmacotherapy, and have the training and expertise for collaborative patient care with ID providers. Although ID pharmacists are recognized as key members of antimicrobial stewardship (AS) programs, this is not where the specialty began, and ID pharmacists fill multiple other roles beyond AS. The specialty of ID pharmacy initially arose as a form of consultancy for complex antimicrobial use cases. The rising complexity of ID pharmacotherapy, among other reasons, necessitates the growth of roles for ID pharmacists outside of positions primarily in AS, which we refer to as ID consultant pharmacists. They may be part of inpatient consultation teams, transitions of care, outpatient ID, and/or pharmaceutical industry/drug development. Various funding mechanisms exist, and additional opportunities should be explored, including hybrid AS and ID consultant pharmacist positions. These roles should continue to be supported and increased to optimize collaborative ID patient care. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Lymphatic endothelial branch chain amino acid catabolic defects undermine cardiac lymphatic integrity and drive HFpEF. Cardiac lymphatic rarefaction and dysfunction is a hallmark of cardiometabolic heart failure with preserved ejection fraction, stimulating lymphangiogenesis, preserved cardiac lymphatic integrity, and alleviated heart failure with preserved ejection fraction in a hypertensive and obese mouse model. Impaired branch-chain amino acid catabolism inhibits vascular endothelial growth factor receptor 3 responsiveness and disrupts downstream ACT, protein kinase B, activation and glucose utilization in lymphatic endothelial cells, thereby suppressing lymphangiogenesis and compromising cardiac lymphatic vasculature. These findings unravel the previously unrecognized role of branch-chain amino acid catabolism in modulating lymphatic biology. Here are the articles from Journals of the American College of Cardiology. Balloon pulmonary angioplasty for chronic thromboembolic pulmonary hypertension. Background. Chronic thromboembolic pulmonary hypertension results from mechanical obstruction of major pulmonary artery lumina with fibrotic tissue. Main treatment has been pulmonary endarterectomy, a complex surgical procedure removing vascular obstruction. However, at least 40% of patients are not candidates for pulmonary endarterectomy because of technical inoperability, comorbidities, or limited access to surgery. Balloon pulmonary angioplasty, BPA, has emerged as an interventional treatment for these patients' conclusions. Our data are in line with previous reports on changes of clinical and hemodynamic parameters and complication rates of BPA. Centers with more experience providing BPAs were more likely to achieve a higher percentage decrease in PVR. From JAMA Cardiology. Asundexian or apixaban in patients with atrial fibrillation, according to prior oral anticoagulant UZIA subgroup analysis of the Oceanic-AF randomized clinical trial. Question. In patients with atrial fibrillation, will those without prior exposure to an oral anticoagulant, OAC, respond differently to a new OAC than patients with OAC exposure? Findings. In this secondary analysis of the oral factor XIa inhibitor asundexian as novel antithrombotic atrial fibrillation, Oceanic-AF, randomized clinical trial including 2,493 participants who were OAC naive and 12,317 who were OAC experienced, compared with those who were OAC experienced, patients who were OAC naive had a smaller increase in stroke or systemic embolism, and a similar lower rate of bleeding with asundexian compared with apixaban. Asundexian caused less bleeding than apixaban in both OAC-naive and OAC-experienced patients, meaning results demonstrate that OAC-naive patients had a significantly smaller increase in stroke or systemic embolism with asundexian compared with apixaban than OAC-experienced patients. The mechanism behind these findings is unknown and deserves further research. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Decreased neutrophils are associated with reduced risk of type 2 diabetes incidence. Context. Numerous studies have reported an association between neutrophils and type 2 diabetes mellitus, T2DM, although this relationship remains unclear. Objective. To investigate the interaction of neutrophils and a dietary intervention on T2DM incidence after 60 months of follow-up. Conclusion. These findings suggest that monitoring neutrophils can help prevent the development of T2DM, as a reduction in neutrophil counts could be associated with improved insulin sensitivity. Following a Mediterranean diet might be a potential strategy to reduce the incidence of T2DM by lowering neutrophil levels. Further research is necessary to gain a deeper understanding regarding this mechanism. Here are the articles from Diabetes Care. Cellular versus acellular matrix products for diabetic foot ulcer treatment. The Dermagraft and Oasis Longitudinal Comparative Efficacy Study, DOLCE, a randomized clinical trial. Objective. To determine whether cellular matrix, CM, products result in better healing rates than acellular matrix, ACM, products for non-healing diabetic foot ulcers. Conclusions. No difference in efficacy was found between SOAK, ACM, and CM, suggesting that SOAK can reduce the economic burden of diabetic foot ulcer treatment. Next we will be discussing articles in the field of neurology. Here are the articles from Neurology. Non-invasive assessment of the risk features of hemorrhage in Moyamoya disease, using 7T MRI background and objectives. While digital subtraction angiography, DSA, is traditionally used for Moyamoya disease, MMD, assessment, its invasiveness and limitations necessitate alternative methods. The higher signal-to-noise ratio, SNR, and contrast-to-noise ratio of 7T MRI improve the clarity of the image and retains the details of the structures. We aimed to assess the performance of 7T MRI in identifying hemorrhagic risk features of MMD, compared with 3T MRI and DSA. Discussion. The 7T TOF MRA visualization of dilatation and branching extension of the aorta and pecoma indicates a heightened risk of hemorrhage, suggesting that this imaging technique could serve as a valuable non-invasive tool for identifying hemorrhagic vulnerabilities in MMD. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Preserved ratio impaired spirometry prevalence, risk factors, and outcomes. Background. The prevalence of chronic respiratory diseases is increasing globally. There is evidence that those with spirometric impairment and no signs of obstruction, termed preserved ratio impaired spirometry, PRISM, have an increased risk of morbidity and mortality compared with those with normal lung function. Several gaps remain in characterizing PRISM. Research question. What are the prevalence, risk factors, and clinical outcomes associated with PRISM globally? Interpretation. Our findings show that individuals with PRISM have an increased risk of all-cause, cardiovascular, and respiratory mortality. Recognizing and targeting modifiable PRISM risk factors may reduce the growing burden of PRISM and transition to obstructive lung disease globally. Additional studies and LMICs are needed to assess unique exposures and disease trajectories relevant to these populations. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Elastance may determine the neuromuscular blockade effect on mortality in acute respiratory distress syndrome. Rationale. Patients with acute respiratory distress syndrome, ARDS, have a reduction in functional lung volume that results in increased respiratory system elastance, ERS. However, the extent of this increase varies by patient. Patients with high ERS are at risk of excess lung distending pressures and may derive greater clinical benefit from neuromuscular blockade, NMB. Conclusions. These findings suggest that the mortality benefit of NMB varies with baseline ERS. High ERS may represent a physiological phenotype of acute respiratory distress syndrome. Future prospective testing to confirm benefit in this potentially treatment-responsive group is needed. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Efficacy and safety of sodium glucose cotransporter 2 inhibitors in patients with and without advanced CKD. Systematic review and meta-analysis. Treatment with sodium glucose cotransporter 2 inhibitor, SGLT2I, provides kidney and cardiovascular protection in patients with advanced CKD. The glycosuric action of SGLT2I is attenuated in advanced CKD, resulting in no change in glycated hemoglobin and fewer volume depletion events. The use of SGLT2I did not increase the incidence of ACI, urine infections, fractures, or treatment discontinuation due to adverse events. Here are the articles from Kidney International Reports. Dotinurad treatment for patients with hyperuricemia complicating CKD. Introduction. The management of hyperuricemia is important to reduce cardiovascular risk and the progression of renal injury in chronic kidney disease, CKD. This study aimed to assess the efficacy and safety of dotinurad, a novel urate transporter 1 inhibitor, in patients with hyperuricemia and CKD. Conclusion. Dotinurad therapy may be well tolerated in patients with hyperuricemia and may have efficacy comparable with existing standard treatment in patients with CKD stages G3/G4. Randomized controlled trials in larger patient groups are needed.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.